Hello guys, welcome back to my YouTube channel. So today we are going to do something amazing. It is a question like what to do immediately after having unprotected sex. Yeah, so let's go directly. My question is, have you ever asked yourself this question? What should I do if I have unprotected sex? What should I do if I am raped? Or have you just had unprotected sex? And you are thinking, like, what should I do? So don't worry, because this video got you covered, yeah? And is meant particularly and purposely for you. Hey everybody, welcome back to my YouTube channel. Karibu sana and feel at home. So today I'll be talking about what you should do immediately after having the unprotected sex. And when I talk about unprotected sex, you all know, yeah? So unprotected sex is the sex without protection, without protecting yourself, yeah? That is without condoms, okay? I hope you've understood. So maybe you forgot, yeah? Maybe you forgot to use those things. Maybe you used the condom and it slipped off, or it got broken, or maybe the sex was not planned for, yeah? And it was an incident of rape, maybe. And this can be super annoying, I understand. And the big question is, what are the dangers and what should I do? So when it comes to unprotected sex, two things are taken into considerations, yeah, and are running through everybody's mind. And I know you know these two things, yeah, and that is the two things are one. The main thing is what do you call it? Unwanted pregnancy, and the second thing is HIV AIDS, mostly. Let's call them STIs, yeah? So let's start with the unwanted pregnancy. So in terms of the unwanted pregnancy, after the unprotected sex, what you can take immediately is a post pill, and that is emergency contraceptive, popularly known as Plan B pills, okay? And the other thing that you can take is your Postina 2, yeah? And they are usually sold in the chemist, just outside your door. The chemist that you see there, you can go and ask them about it. This post pill is taken within 72 hours. And that is after sexual intercourse, yeah, and that's within the period of 3 days. And there are some things that you should take note of when it comes to Postina 2, yeah, and as you need to be very careful about them, because as the hours increases, the efficacy decreases. So this is an emergency contraceptive that should be taken immediately after sex, yeah. Postina 2 on this emergency contraception is not an abortion drugs. You need to know that. So even if you take Postina 2 as far as the baby is formed, it cannot take away or tamper the pregnancy, yeah. The main thing that you need to know, it is not an abortion drug, yeah. So for those that keep taking overdose of Postina 2 with the mindset of flushing out the baby, like getting rid of pregnancy, you need to know that it should be taken within 72 hours of sexual intercourse, yeah? And there are some minor side effects that can come with it. For example, nausea, and a little bit of bleeding after using it, yeah. And you need not to worry about them, but above all, just know that it is not an abortion drugs, but you need to take them immediately, and it's gonna help you prevent get pregnant. Yeah. So the second thing that you can do is to get an IUD inserted up to 5 days. That is within 5 days of having that unprotected sex. IUD is simply an intrauterine device, and it's possible after the whole unprotected sex you were scared, very scared, and you couldn't speak out, and now it's maybe about 2 to 3 days, and so you are like, how do I prevent this? How do I prevent myself from getting pregnant? The thing you should do is to get an IUD inserted, so that is within 5 days of having that sex, and an IUD inserted, and that is going to help you prevent unwanted pregnancy. Yeah. An IUD is 99% effective when it comes to the matter of contraception. Yeah. It's even more effective than your Postina 2, that is your emergency contraception. That the good thing about IUD is that when you put it, it can help you prevent pregnancy for a lot of years. Yeah. For people who put this IUD and develop some little complications such as bleeding, it's advisable you consult your doctor. There are some contraindications, yeah, to the use of the IUD. Some of the contraindications to the use of IUD include: if you have infection, it's advisable you treat the infection generally before using an IUD. If you have fibroids, you have an history of bleeding, you have pregnancy, you're suspected that you have malignancy, IUD might be contraindicated for you. And after doing all this, you've picked an emergency contraceptive or used the intrauterine device. It's advisable to do a pregnancy test 2 to 3 weeks after the unprotected sex. Okay. It's not advisable to do the pregnancy test very early because the hormone that is being detected, that is the human chorionic gonadotropin hormone, might not be enough in the urine or even the bloodstream to do the test. That's why it is advisable for you to do this test 2 to 3 weeks after the unprotected sex. The second thing that usually worries people is sexually transmitted infections. How do you prevent sexually transmitted infections after the unprotected sex? The first one is you take a nice and a very nice shower after the unprotected sex. Wash up very well, but don't dote. It's very harmful to dote your VJ. Put your fingers in your VJ and wash it all in the name of bringing all the sperm and infections out. Just take a nice shower. Wash your vulva with water, with warm water, or with mild soap that you usually use. So that's going to do a long way to help. The second is pee after that unprotected sex. That peeing after unprotected sex might help you from from urinary tract infection. Might also help in one way or the other to bring out some of those bacteria that has been placed inside. Then drink a lot of water, because drinking a lot of water will cause your body to want to urinate. Yeah. The other point which is very important is to book an appointment with your doctor, and this is superly important. Yeah. One thing you should know, and that is that once some of the sexually transmitted infections can be treated and can be prevented. For example, gonorrhea, chlamydia, trichomoniasis, and etc. When your doctor notices this, they can give you some antibiotics and some medications that can help to treat them. But some might be difficult to treat, and they have to be managed. For example, hepatitis and herpes. When you book an appointment with your doctor, he or she is able to tell you when you should go for a particular test, because some of these infections, that is the STIs, may not show up immediately after the unprotected sex, yeah? So that's why your doctor is gonna say in 2 months time, for example. For the other disease, he might say 1 month, etc. Also, do a proper examination so as to know if you have the bacteria in your bloodstream. So they might do some blood sample analysis, some urine sample, vaginal swab, etc. It all depends. So booking an appointment with your doctor is going to do along with a lot of things, yeah? I'm going to talk about HIV, of course. Let's talk about HIV. So if you have suspected that your partner, that is the person you had the unprotected sex with, has HIV AIDS, it's advisable you speak to your doctor, and they give you some post-exposure prophylaxis, yeah? This helps to build your immune system to fight against HIV, yeah? If this partner of yours has HIV, that is. You also need to know that be it anal sex or oral sex or vaginal sex, yeah, all these can result in sexually transmitted infection. So you need to be extra careful, yeah. Don't think it's just penis and vaginal sex that result in sexually transmitted infection. No, 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 no. No, 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 no. So if time goes on, after the unprotected sex, you notice some of the signs of STIs, sexually transmitted infections, which include the signs of painful voice, dirty vaginal discharge, fever, pain, itching in the lower abdomen. And it is advisable you contact your doctor and get the useful and proper treatment, yeah? You need to know that one of the common causes of urinary tract infection, which is popularly known as UTI, is sexual activities, yeah? And you need to be very careful about that, yeah? Most of the public toilets we keep hearing about, sexual activities is one of the most common cause of UTI, and that's why it's important for you to pee after sexual intercourse. Wash down there very careful, yeah? Drink a lot of water to reduce your chances of getting urinary tract infection. Up to that point, I hope that those points have been useful, have been beneficial to you all, and that you will enjoy them. Up to that point, be careful with unprotected sex, yeah, but you can try these measures. Hope you've enjoyed the video up to that point. Let me know your thoughts in the comment section. Kindly like, share, and subscribe. The most important thing, don't forget to turn on the notification bell so that whenever I upload such amazing video, you'll be among the very first person to get notified. Bye bye for now. Let's meet in our next video.